I'm Dr. Rae Lynne Kinler, and I am a hair restoration surgeon, and I've been doing that for about 5 years. So one of my favorite procedures is facial hair restoration, and it can be done in pretty much any patient that has either no facial hair, sparse facial hair, patchy facial hair, just wants more density, and a pre-existing beard, as well as patients who have transitioned from female to male and want a more masculine look. That is considering doing facial hair transplant needs to have hair to donate, which is typically taken from the back of the scalp, although some body hair may be used, but that's typically reserved for patients who already have an existing beard and just need to fill in some areas for density. So if a patient already has existing male pattern loss on their scalp and they want to consider doing facial hair transplant, then they kind of have to weigh, do they want more to worry about the face or do they want to worry more about the scalp? So for most patients, what they end up doing is they want to restore their scalp first and then restore the facial hair down the line, and then typically we'll take things like chest hair, occasionally arm hair, and any leftover scalp hair if it's available. If you let your beard grow out and your normal facial hair is more straight and your chest hair is more curly, then obviously it's going to look more like chest hair.
Okay, that's great. It's longer.
Which is why we would typically reserve that for patients who just need a little bit of fill. So one of my more recent patients came in and he wanted to do or undergo facial hair restoration. He already had a pre-existing jawline as well as a little bit in the goatee and a pretty nice mustache. So he just wanted to get more of a design that he could bring up higher and have a little bit more fill in the cheeks and then fill in more in the chin as well. So that's what we did for his procedure. I believe we got somewhere in the 2,800 graft range. We did it via FUE, so that's individual 1 by 1, and we transplanted between 1 and 2 hair grafts on that patient. And this is a patient I was referring to. Most patients, they do end up doing more than one procedure if they can, because most patients, the initial surgery is more for just coverage and establishing a nice design, and then the second surgery is more for density, as the big beard of the lumberjack beard seems to be the most in thing right now. It's literally like they call it, patients when they come in, it's like, I just want big and full. And we call it lumberjack because it's big and full and curly, and the #1 requested procedure at this point.
How was your first video?
It was fine. I don't mind. I just like to give you a hard time.